Hi, I'm Dr. Raymond Zakari. I'm a nurse practitioner, board certified in family practice and psychiatry. The purpose of this talk is to talk to nurses and sober companions that may be assisting in a withdrawal management at home, also sometimes known as home detox. The purpose of this talk is to review the symptoms that may arise in the process of withdrawing from opioids and benzodiazepines. We'll pair those symptoms on a scale to help decide what medications should be used in order to make the process more comfortable and to increase the likelihood of success in order to do this in the home. I'm also going to finish by talking about some non-pharmacologic interventions that are also often helpful. Warning, this is not intended to be medical advice, but edutainment only. This is intended to be used only in supervision and working with a provider, such as a nurse practitioner or physician assistant. And it is essential that the client is willing to participate. This cannot be done by coercion or insistence. In the home requires cooperation. Let's talk about the Clinical Institute Withdrawal for Alcohol scale. This is also known as the CIWA scale. This basically breaks your symptoms into minimal to none, mild to moderate, and severe. If you're having severe symptoms of alcohol or benzodiazepine withdrawal, you're going to need to go to the hospital. So we want to keep the symptoms of withdrawal from getting to the severe range, and I hopefully will tell you how to do that. How is the CIWA calculated? Well, we look at several symptoms that the body may have in response to suddenly not having the same central nervous suppressant, alcohol, in the system. Now, we don't want the body to wake up too quickly. That's why we will use benzodiazepines in controlled amounts to allow the body to naturally wake up as it removes the alcohol and toxins from the system, assuming the liver is working normally. One of the most common symptoms we can notice is nausea and vomiting. And this is rated on a 1 to 7 scale. And you would rate this person hourly after they've been in the similar position for about 30 minutes. And the reason is you don't want to attribute their nausea to, say, motion sickness or laying upside down or anything like that. You're really trying to figure out, is this really due to withdrawal or not? Another common symptom that may occur is tremor, and you will notice the tremor in the hands, and it may be visible or they may tell you they have it, but you're going to also rate that on a 1 to 7 scale. The more severe, the higher the number. At the end of this scale, you're going to come up with a composite score that will tell you where in the withdrawal classification system they are, and that will determine what the medication ought to be. Another symptom you may notice is something called paroxysmal sweating, and that just means sudden sweating, and you may see it or they may feel it, depending on the level of severity determines the amount that you will score them. Another common symptom, which often precedes even wanting to enter into a detox program, is anxiety. They may have actual anxiety or anxiety about what they think they're going to experience, and you're just going to ask the question simply, do you feel nervous? And a lot of times they won't, because they may actually be intoxicated at the beginning of this process. As the alcohol or benzo goes down in the system, they may then start to have feelings of anxiety. Another symptom to look for in the alcohol and benzo withdrawal is agitation. They can have no agitation whatsoever, seemingly normal, to pacing back and forth and not able to sit still for any length of time, and that would give them a 7. Another symptom they may experience are tactile disturbances, and you can ask this by, do you have any itching, pins and needles, or sensations of burning and numbness? Also, they may feel like creepy crawly bugs. The problem with this is, of course, if you've had so much alcohol for so long, is you can develop a condition called alcoholic neuropathy, and that may indeed be the symptom they're feeling. We're not going to really know for sure. We're going to take them at what they're reporting, but another way to ask the question is in relation to how you usually feel. Do you have more or less? Another symptom to think about is auditory disturbances. Now, as the central nervous system wakes up, they may be more sensitive to all nerve inputs, touch and hearing. And so things may seem louder. They may hear things that we don't hear. They may make up things because the brain is becoming more active. And so you're going to assess for auditory disturbances from very mild to continuing hallucinations of hearing voices. Visual disturbances, another thing controlled by the central nervous system, they may be simply photophobic, meaning, I can't look at the light, I need to wear sunglasses, to outright seeing things that are not there. They may start to pick at the air, and if you notice that, that's a severe visual hallucination. If they're having a lot of feelings through their senses, hearing, seeing, touch, that is an indication that the system has woken up too fast and we're going to have to slow that process down. Another symptom they may have is headache. This could be a hangover headache. It could be from mild to severe. Do not confound headache for dizziness or lightheadedness. That's separate. We just want to know, does your head hurt, feel full, feel like there's pressure? That's what we're looking for when we ask about headache. And then orientation, clouding of sensorium. This is just concretely done, and you'll ask these questions every couple of hours as they go through the process. What day is it? Where are you? How am I? You might ask them to do simple math. And there's a grading scale, as you can see here, how much disoriented they are. By 2 days, they get 2 points. By more than 2 days, they get 3 points. If they don't know where we are or who we are, they get 4 points. And you can grade it that way. If you work with me, I will send you an electronic scale where you tick off this list hourly as we go through the process so that we can have a good understanding of how fast they are indeed withdrawing. Another thing we do on the CWA scale is we want to record vital signs because they may have a really fast heart rate or really high or really low blood pressure, and those indicators would warrant more aggressive intervention as well. The most common medication used to facilitate alcohol or benzodiazepine withdrawal would be benzodiazepines. Now, we don't use the common stuff. What we try to do is consolidate all of the medications to something with a long half-life. Most commonly Valium or Librium. If there's liver injury, we would use Ativan. And the reason we're doing that is what we're going to end up doing is gradually stacking the meds over time and then allow the body to more slowly metabolize the sedative out of the system. The problem with alcohol and all the other benzos that people get addicted to is the half-lives are very short. So they leave the body quickly, which means you need to restabilize quickly. So you keep drinking or keep taking pills. We want to consolidate them to long-acting medications to bridge them to allow the body a natural detoxification process. But these are some of the medications we can use. Some are used individually and sometimes in combination. Now I'm going to switch gears and talk about opioids. Opioids, as you know, is a major epidemic. Typically, opioid withdrawal is not fatal, but alcohol and benzodiazepine can be. That one requires the real monitoring. Opioid withdrawal can just be uncomfortable, but typically not fatal. The problem is if they're mixing both opioids and benzos, it can be very difficult to tease out what are they withdrawing from faster. If it's the benzo, that could be a problem. When you withdraw from opioids, these are the symptoms you may notice in the patient or they will report to you. Resting pulse rate. So you'll check the pulse. If it's less than 80, probably not in withdrawal. But the higher the pulse, with these ranges, you'll assign a score. Also, same for sweating. They have to be in a comfortable room. It can't be 100 degrees and they're sweating due to the room climate. But you're going to check for, how badly does the sweating look? From nothing to I'm having chills and sweating and it's beating off my face. Another symptom would be bone and joint aches. If the patient's having pain previously, which is why they're on the opioid, this has to be separate from the pain they may be having now in relation to coming off the opioid. So it'll be important to distinguish that. They may have chronic pain, but that's not the pain we're talking about. Again, this also suppresses the ability of the body to sense. So when it wakes up too fast, all senses can be heightened, and the person may have increased anxiety due to the fear of a pain they think they will feel. Pupil size is another one. You want to check the pupils with a pen light and see how they're doing. The larger the pupil, the more opioid is out of the system fast. The pupil should not be dilated. And if they're pinpoint, it means they're actively intoxicated. So we're going to slowly manage that withdrawal process with the supported medications. Here are some other symptoms to have. Runny nose and tearing, depending on how much is going on. GI upset from cramps to multiple episodes of vomiting. Goose flesh, also known as piloerection. If they're having the goosebumps, they could have a score of 3. But if you really can see them, like you just don't feel them with your ear, but you can see them from across the room, they can have a 5. Tremor, yawning, and anxiety and irritability. Now, ideally, you do not want to start the withdrawal medication Suboxone until they're scoring a 10 or more on the COW scale. If you start it too low, they may accelerate their withdrawal symptoms and feel worse. And at that point, there's really nothing to do but maybe give them more. The reason you want to wait till you get to a 10 is you want the Suboxone, if you're using it, to provide the necessary relief. In the meantime, though, before they get to a 10, these are some other pharmacologic agents that can reduce the intensity of symptoms. They may never get to a 10 with sufficient support meds like these other agents. And if they never get to a 10, they may not need the Suboxone long term. Now, Suboxone is viable. The reason I make this known up front is we don't really have a good way to come off of Suboxone. There are some anecdotes, but we're going to have to go through a withdrawal process again, probably, with these supportive meds to come off of that. So that decision needs to be made in advance. Are we going to use Suboxone to detox? That's basically 3 days. Or are we going to use it for maintenance, and that's going to be ongoing? But that conversation can be had. Suffice it to say, these other medications can be quite effective in reducing any discomfort associated with withdrawal. And I use these often when we do a home detox withdrawal management program. Now, in addition to the pharmacologic, the non-pharmacologic support is quite effective. When someone is withdrawing, we don't want to overwhelm the senses. So a dimly lit room. Showering at least twice a day goes a long way. Warm shower, hot shower, cold shower, whatever makes them feel comfortable. Usually it's warm, and that tends to relax them. Deep breathing exercises. This is one of the things that people can actually control. One of the biggest drivers of anxiety is feeling like you're out of control. So when we start with the deep breathing exercise, it's a very primitive reminder that it's not all out of your control, and you can practice with deep breathing. Guided meditation, you can't choose how to feel, but you can choose what to think about and what you envision and what you dwell upon. Well, that, through guided meditation, can make you feel less anxious, more at peace. Music, whatever you like, is fine. Ideally something soft and mellow so that you're not overwhelming senses and exciting yourself. And the biggest symptom that you want to go after in a home detox withdrawal management is sleep. We need to consolidate the sleep. So it's okay if they're very sleepy for the first few days. We will gradually turn down those meds. You will become less sleepy, and then the person will be able to wake up. We want sufficient distraction, engagement, and stimulation during the day, but at night we really want to get good sleep. It makes you more resilient, less irritable, less anxious, creates a better mood, and it gives you the energy to do some of that light exercise that will help get your natural endorphins surging again. Finally, nutritional support and hydration. If someone has been struggling with addiction for a long time, oftentimes their physical health has been neglected. So there's a lot of sometimes malnutrition that goes on, specifically with alcohol, because it can limit your ability to absorb thiamine, and that can lead to a hallucination and what we call a delirium. So that is the one nutrient that we are aggressive to replete early on in the withdrawal process. So let me summarize. Detox is the process that happens as medication leaves the body. Withdrawal management is the process of supporting the body through as it goes through its natural body functions. Benzodiazepine and alcohol withdrawal can be fatal. That's why supervision and support is essential. Opioid withdrawal is not known to be fatal, and for both of those we use medications to reduce any discomfort. Home withdrawal management requires a willingness and a cooperation on the part of the patient and ideally a support network. No one can do this alone. There's going to need to be someone to hand off to after the initial process, a sober companion, a friend, or a family member, preferably somebody that is not going to enable the addictive behavior again. The nurse and the sober companion will communicate with the provider throughout the detox process to adjust the medications in a way to maximize comfort. And overall, especially with benzodiazepine and alcohol, there is a very low threshold for hospitalization because of how severe the symptoms can arise. So if the person suddenly starts drinking during the detox, starts using anything, becomes very disoriented, is not responding to oral meds, that's a 911 to the ER case. So I hope you found this helpful, and maybe you'll share it with someone that will find it helpful. Thanks for watching.